there, lovely ladies. Welcome back to Aquos Pharmacy, your go-to source for all things health and wellness. And today, we're shining the light on women's health and tackling a topic that's often shrouded in mystery and misconception: vaginal health. It's time to break the silence, dispel the myth, and get informed about what's typical and what's not when it comes to your vagina. Whether you're experiencing strange symptoms, or you have questions about your menstrual cycle, or you simply just want to take control of your reproductive health, this video is for you. So let's dive in and explore the wonderful world of vaginal health together. Vaginal discharge is a natural and normal part of our reproductive health. It's produced by the cervix and it helps to clean and lubricate the vagina. But have you ever wondered what's typical and what's not when it comes to vaginal discharge? Let's take a closer look. Clear or transparent discharge is usually a sign of ovulation, while white or off-white discharge can indicate a healthy vagina. You may also notice a slight yellowish tint, which is normal as long as it's not accompanied by itching, burning, or a strong odor. On the other hand, if your discharge is thick, clumpy, or has a strong, unpleasant smell, it could be a sign of an infection or imbalance. Similarly, if you notice a sudden change in color, consistency, or amount of discharge, it's best to consult with your healthcare provider. Remember, vaginal discharge can change throughout your menstrual cycle. It's normal to experience more discharge during ovulation and less during your period, but if you're ever in doubt, please consult a healthcare professional. Vaginal odor is a common concern for many women, and it's important to know what's typical and what's not. A healthy vagina should have a mild, slightly sweet smell, often described as earthy or musky. This natural scent is produced by the bacteria that lives in your vagina and helps to keep it healthy. But if you notice a strong, fishy, or unpleasant odor, it may be a sign of an infection or imbalance. Bacterial vaginosis, yeast infections, and trichomoniasis can all cause unusual vaginal odors. Additionally, factors like poor hygiene, tight clothing, and certain foods can also affect the way your vagina smells. To keep your vagina healthy and odor-free, practice good hygiene by wiping from the front to the back, washing with gentle soap and water, and avoiding scented products or douches. If you do notice an unusual odor, don't hesitate to consult your healthcare provider to rule out any underlying infections or imbalances. Vaginal itching and burning can be very uncomfortable and frustrating, especially if you don't know what's causing it. But what's typical and what's not? Let's find out. Vaginal itching, also known as vulvar pruritus, can be caused by a variety of factors including yeast infections, bacterial vaginosis, allergies, and irritations from soaps or lubricants. If you experience itching or burning during sex, it may be a sign of a yeast infection or allergic reaction. Additionally, if you notice any unusual discharge, redness, or swelling, it's best to consult with your healthcare provider. Yeast infections caused by an overgrowth of candida can cause intense itching, burning, and a thick white discharge. Bacterial vaginosis, on the other hand, can cause a grayish discharge and a strong fishy odor. Allergic reactions to soaps, lubricants, or latex can also cause itching and burning, and if you're experiencing itching or burning during sex, it may be a sign of an underlying condition such as vulvodynia or vaginitis. To prevent vaginal itching and burning, practice good hygiene by avoiding harsh soaps, using gentle lubricants, and wearing breathable clothing. And if you do experience any unusual symptoms, please consult with your healthcare provider for proper diagnosis and treatment. Vaginal bleeding is a common concern for many women, and it's essential to know what's typical and what is not. So let's break it down. Typical vaginal bleeding, also known as menstruation, occurs every 21 to 35 days and it lasts for 3 to 7 days. It's a natural part of the menstrual cycle, and the bleeding is usually bright red, flowing, and consistent. However, if you experience heavy bleeding, clotting, or bleeding between periods, it may be a sign of an underlying health issue. Heavy bleeding, also known as menorrhagia, can be caused by hormonal imbalances, uterine fibroids, or polyps. Clotting, on the other hand, can be a sign of a blood clotting disorder or a miscarriage. spotting or light bleeding can occur between periods due to hormonal changes, ovulation, or pregnancy. However, if you experience heavy or prolonged bleeding, it's essential to consult with your healthcare provider to rule out any underlying conditions. Irregular menstrual cycles, such as polycystic ovary syndrome, can also cause abnormal bleeding. Other factors like stress, weight changes, and certain medications can affect your menstrual cycle and lead to abnormal bleeding. To manage vaginal bleeding, practice good hygiene by using sanitary products, changing them every 4 to 8 hours, and washing your hands before and after handling products. If you experience any unusual bleeding, please contact your healthcare provider for proper diagnosis and treatment. Vaginal pain can be very distressing and affect your overall well-being. Let's explore what's typical and what is not. Typical vaginal pain, such as mild discomfort or burning during sex, can be caused by vaginal dryness, yeast infections, or allergic reactions to soaps or lubricants. However, if you experience severe pain, itching, or burning, it may be a sign of an underlying health issue. Vaginal infections like yeast infections, bacterial vaginosis, or trichomoniasis can cause pain, itching, and burning. These infections can be treated with antibiotics or antifungal medications. Vulvodynia, a chronic pain condition, can cause persistent pain in the vulva, vagina, or pelvis. This condition can be treated with physical therapy, pain management, and lifestyle changes. Endometriosis, a condition where tissue similar to the lining of the uterus rolls outside the uterus, can cause painful periods, heavy bleeding, and pain during sex. To prevent vaginal pain, practice good hygiene by avoiding harsh soaps, using gentle lubricants, and wearing breathable clothing. If you experience any unusual pain or discomfort, please contact your healthcare provider for proper diagnosis and treatment. And there you have it, ladies. Now you know what's typical and what's not when it comes to your vagina. Remember, vaginal health is important, and seeking medical attention when something feels off is crucial. Thanks for watching, and don't forget to subscribe for more informative content.